Vance's nonprofit turned out to be a superficial charade that was clearly meant to bolster his political career more than anything else. In its first year, the group spent more money paying Vance's top political advisor than on programs to fight the opioid epidemic. And the group conducting polling that was probably used to test the waters for a future J.D. Vance run for office. It would be bad enough if the group did nothing at all to address the opioid epidemic, but what Vance's opioid nonprofit did was worse. Last week, an Associated Press report revealed J.D. Vance enlisted the help of big Pharma-Backed doctor to treat Ohioans struggling with addiction. This doctor has a well-documented record of blaming individuals for addiction and excusing the role of OxyContin and prescription painkillers in this public health crisis. We here in Ohio know that that couldn't be further from the truth. Purdue Pharma aggressively marketed OxyContin, and our communities have been devastated as a result. J.D. Vance should be ashamed of his recruiting a doctor who has dismissed the pains of thousands of Ohioans. He owes them an apology. But instead of apologizing, J.D. Vance said he is proud of the work this doctor did in Ohio. For J.D. Vance to bring a Purdue Pharma puppet to Ohio is a betrayal, and it shows us that he's unfit to serve in the United States Senate. He'll only be there to support the big drug companies at expense of Ohioans. With us today to talk more about this is Representative Gerals and Pastor Nancy Day Akar, who have both worked on this issue and care deeply about fixing the opioid crisis in Ohio. And with that, I'm going to turn it over to Representative Gerals, who has worked really hard to combat opioids here in Ohio and in his district.
Thank you so much, Chair Walters, and good morning, everyone who is watching. My name is Dontavius Gerals. I'm proud to be the state representative for House District 25. And, you know, I'm here today partly because this issue is so personal to me. I remember my time, even prior to me being elected, where we traveled across the state and spoke with families about the realities that opioids had on their lives. We talked to loved ones who lost kids, simply because they misused prescription drugs. We talked about the emergence of fentanyl in our communities and heroin, and did everything we could on a policy front to save lives. So this issue for me is incredibly personal, because what we say and what we do in this state literally means the difference between life or death for families. Just to give you a little bit of a perspective on the real realities that we are facing in this state. In Ohio, we had an estimated 5,585 overdose deaths from April of 2020 to 2021, a 26% increase in drug overdoses compared to previous decades. Those are lives from every zip code, every socioeconomic status, regardless of race and gender, affected and changed simply because of this issue we're talking about today. Next month is designated Recovery Month, and I'm proud to be one of the sponsor for a recovery license plate to really help families provide hope and center voices on celebrating recovery. So I want to say this to all those who are watching, that who have navigated this recovery space. I see you, I hear you, and I celebrate you. But let me be clear. Addiction is not a moral failing. And for Tim's opponent to bring someone to Ohio who believes in this rhetoric, unfortunately shows just how important it is that we elect Tim Ryan to the U.S. Senate. I vehemently disagree with Dr. Centel's remarks that addiction is a symptom of something that's derailed, dislocated within the person. What we know is true. Addiction can affect anybody, regardless of their zip code, regardless of their lived experience, regardless of their race or where they come from. So the contrast to this issue could not be more clear. Tim Ryan has worked across party lines to advocate for an approach to an emergency that combines treatment, law enforcement, and prevention together. He was the lead Democratic sponsor of the landmark Bipartisan Comprehensive Addiction and Recovery Act, and is working to build by passing the CARA 3.0. Tim has also served hundreds of millions of dollars for substance use prevention, treatment, and recovery support services right here in this state. Real leadership on an issue that affects so many of us. I'm proud to stand with Tim Ryan on a number of reasons, but this one for me is the biggest because we need someone in this space, in this seat, who truly has the compassion and care for families dealing with this crisis. We know it affects all of us. And for Tim, he's committed to building a better Ohio with all of us included. And so with that, I want to bring over Pastor Nancy Day Hour for additional remarks. Thank you all.
Thank you so much, Dontavius. It's been an honor to know you over the years and see the incredible work that you do for our community. I am a pastor on the west side of Columbus, a community that has been devastated by the opiate epidemic. When I saw the devastation when I was appointed there to the west side, I knew that I had to do something about it. And so I have worked hard for years doing prevention and education and harm reduction to try and help create a better future for the west side of Columbus, but also for all of Ohio. And so hearing what J.D. Vance has done, he should be ashamed of bringing big pharma, a big pharma mouthpiece to our in the face to all of us who have been doing in this state. We've worked hard to combat the opiate epidemic, and we still have a very long way to go to make things better for our state. And instead of joining us in the hard work of many healthcare professionals, law enforcement, government officials, and community coalitions who are doing great work to beat back this epidemic, J.D. Vance saw an opportunity to help himself. Vance created a sham nonprofit that did nothing to combat the opioid epidemic. It did everything to help him launch his political career. A nonprofit expert has called J.D. Vance's nonprofit a charade and superficial. In its first year, the group spent more money paying J.D. Vance's top political advisor than on programs to fight the opioid epidemic. All those programs that work to fight opioid misuse in this state were shortchanged because he was spending money on himself. That same year that he started that organization, I started a community coalition on the west side of Columbus to educate community members about the opioid epidemic, addiction prevention, and harm reduction. We reached hundreds of residents that year with a total budget of $600 that we scraped together with everybody just chipping in a few bucks so that we could spend it on advertising so people would know about our education events. Wow, what we could have done with the kind of money J.D. Vance had. The following year, I was begging people for donations so we could buy naloxone because the Hilltop was a hot spot for overdoses. J.D. Vance could have spent his money saving lives of the people living on this same street, but he didn't. He could have helped the mini opiate epidemic task force in Ohio that were desperate for money to support their evidence-based programs. He could have helped expand the Walk-In for Recovery program here in Columbus, but instead, he spent the money on himself. And last week, that bombshell report revealed that Vance sought the help of a big pharma-backed doctor to come and treat patients in Southern Ohio. Dr. Sally Sattel is no friend to Ohio, but is a friend of Purdue Pharma. She's so close to Purdue Pharma that she asked them for pointers on what she should say before she published articles. Dr. Sattel's views are dangerous for Ohioans, but they're a gift to Purdue Pharma. She questioned the role of OxyContin in the opioid epidemic while Purdue Pharma continued to reap massive profits, and Ohioans were left to pick up the pieces. And not surprisingly, Dr. Sattel's employer was paid handsomely as many Ohioans overdosed. A friend of mine was one of those overdoses. He asked for help finding a rehab center, but no one had any beds available. Ohio still doesn't have enough beds available. And I know so many parents who have lost a child to an overdose because they were unable to get treatment. Their hopes and dreams of the future have been destroyed. So many lives could have been helped by J.D. Vance. After leaving Ohio, Dr. Sattel continued to use our state for her own and Purdue Pharma's purposes, arguing that addiction was a result of an individual, not the aggressive marketing and overprescribing of OxyContin and other opioids. No one chooses to become addicted to a medication. Addiction is not a moral failure. It's a chronic relapsing brain disease. My brother has this disease. And over the years, I have had several friends with this disease. Decent people who became addicted to the painkillers their doctor overprescribed because Big Pharma said it was safe. Dr. Sattel doesn't know what she's talking about. And now J.D. Vance has the nerve to say that he's proud of the work Dr. Sattel did in Ohio? I would just ask J.D. Vance, what is there to be proud of? A Big Pharma puppet exploiting our state for her own gain? And what part of Dr. Sattel's work is J.D. Vance most proud of? Ohioans need real help to end this opioid epidemic. But J.D. Vance recruited a Big Pharma puppet who only looks out for Big Pharma. He should be ashamed of himself. He should be begging forgiveness to all the Ohioans, the ones who are suffering from substance misuse disorder, and all those who have lost their loved ones to this disorder. It is shameful. He should be ashamed of himself.